2 weeks in September, the eyes of all nations are on New York City as global leaders gather at the UN to talk about our biggest problems. Problems like, is the world ready for the next pandemic? That's what public health experts from more than 100 countries asked each other this week. Phyllis Arthur, Bio's head of infectious disease and science policy, was invited to participate.
Governments, in partnership with manufacturers, should invest in geographically diverse regional manufacturing expansion during this period between pandemics. Making these investments now will aid in the development of new technologies that could be rapidly deployed around the world during the next public health emergency. All of this must happen against a backdrop of vital health system strengthening in every nation, including better surveillance. We must be able to rapidly recognize an infectious disease, implement test and treat systems leveraging easy-to-use antivirals, and deploy vaccines potentially to people of all ages.
Arthur told the group that the biotech industry will help put together governments and the private sector to develop the tools we need to improve access to life-saving treatments.
Lastly, we need a mechanism for procurement that is well-funded at the start of the emergency. Regional and global procurement mechanisms must be funded such that industry can rapidly work with multinational organizations to ensure real-time, equitable access to medical countermeasures.
The world learned many lessons from the pandemic, but one stands out. We must invest now if we want to win the fight later on. This is Bio.News.